Thank you so much for joining us here on Open Line tonight on News Channel 5 Plus. My name is Chris Conti. This is Gordon Bonnyman from the Tennessee Justice Center. Tonight we are continuing our conversation that we started over on News Channel 5 at 6 o'clock with our special report, Living in the Gap. And then we continued that conversation. We took it over to Facebook Live, where we answered some of your questions there for a little while. And now we are wrapping things up here on News Channel 5 Plus, where we're giving some of you a chance to call in. Let's just get right to it, Gordon. We have a lot of folks on hold. John is on line 4 here. John, what is your question? Where do you live?
I live in Cross Plains, Tennessee.
Cross Plains, okay. And do you have insurance right now? Do you currently have health insurance?
No, sir. I ain't never had any insurance.
Never had any, okay.
No, sir.
And are you having any medical problems? What's your question here?
Yes, sir. I've been shot in my back, in my lower back in '89. I lost 60% of my stomach. And I done had 2 massive heart attacks. I got 4 stents in my heart. And I'm 56 years old. And I work a job. I make $300 a week. All right. I pay $130 a week, not count my lights, not count my water, not count my food. And it ain't nobody but me, you know. And I don't know where to start or where to go. Every time I go to a hospital, I have to lie, you know, tell him I live in Nashville so I could get in General Hospital.
Yeah.
You know, and that's bad. But that's the only way I can get any help, because up here in Robertson County, I can't get in the hospital.
Yeah, and have you ever looked into, I know obviously if someone needs immediate medical care and it's emergency, they need to go to the hospital, but maybe, we were talking about this earlier, are there any resources for folks that maybe at least want to see a doctor and get some kind of checkup or be looked at? What kind of options are there for people?
Well, John, you probably know about this, but there are some good faith-based clinics in both in Nashville and in the communities around Nashville that do a good job of seeing people for checkups and those sorts of things. Where people get into trouble is if they need tests, they need prescription drugs, they need hospitalization, and that's where someone like John is really stuck.
Right. We have Liz, who I believe has been holding on line 5 for us. Liz, can you hear me?
Yes, I can.
Okay, and where are you calling from?
I'm calling from the Mount Juliet area.
Mount Juliet. And do you currently have health insurance?
No, I do not.
You do not. Okay, what's going on?
I went to the marketplace. I tried to get the insurance. I got one that was asked for C. They gave me E. I called to try to get it changed 3 or 4 times. Had a broker trying to get it changed. It went from $295 to $597 a month, which I couldn't afford that because I'm 60 years old, trying to take care of myself.
And this is on the Federal Exchange you're talking about?
That's on the Federal Exchange.
Okay.
So now they're penalizing me. They penalized me, and they're still penalizing me because I don't have. But now I have medical issues that I was in the hospital, and I got almost a $40,000 bill just from last month, and I've got to pay that. I don't know which way I can go, because now they tell me I can't apply for it, the exchange, because it's going to cost me $800 some dollars.
And are you working right now, or are you?
Yes, I work. I work every day.
Okay, and you just obviously you're just not making enough to
not enough to cover for that kind of expense.
Right.
I'm trying to pay for a home and car, and and the cost of living. I got a grandson that's in college that I've raised.
Yeah. Let's see what Gordon's here, if he has some thoughts.
Liz, let me just ask, is $800, do you get any kind of premium tax credit against that? Or is that do you have to do that without a tax credit?
Without a tax credit.
You don't qualify for a premium tax credit?
Only $200 and some was the tax credit that I got.
Okay, so you get a tax credit, but it's not enough to make the difference that you need.
To make a difference, no.
Well, I'm sorry. It sounds like you're really up the creek. That's another problem with Obamacare, is that we're finding that the premiums are rising and that sometimes the tax credits are not enough. We're going to see all of that revisited next year with a new Congress and a new president. I think it's important for people like you to let their representatives, our state senators, our U.S. senators, Senator Alexander, Senator Corker, know that the system is not working for you now, and if they're going to repeal Obamacare, they need to make sure they replace it with something that works. They can't just repeal it, walk away, and leave a whole lot of people in the lurch.
Yeah. Let's go to someone now who is sure to liven up this conversation, Reverend Enoch Fuzz, who is a frequent caller here. Reverend, how are you doing tonight?
Hey, I'm doing good. I have to congratulate you on having Gordon Bonneman on your show tonight. I hope people know who he is. A very iconic contributor to the healthcare campaign. And, you know, I've worked with Gordon and had, you know, the intimate relationship of his kind of wisdom and the Tennessee Justice Center and the healthcare campaign with Tony Garr. And I founded the NAACP Health Committee, but I'm also, the past 10 years at least, been on the board at the General Hospital Foundation board and on a couple of other clinics and work with doctors.
Yeah.
This issue, and I know a lot of people who don't have coverage. I mean, pastors, middle-class working people around me in my community. I know lots of folk who do not have coverage. They can't afford the $500 a month and deductibles that are, you know, like $4,000 a year, whatever, even though it's a better deal. But there's lots of folk out here without health care. But now I want to put this to Gordon tonight because General Hospital, and I want to ask him to comment on that. I know they're getting ready to ask the city council for maybe $10 million, which, you know, it's a no-brainer. To me, it's a gold mine and a jewel in this city, and I heard a lot of your callers. That's a place that this city could provide affordable health care, partnered with a university. It's probably the only one in the nation, or probably there's only two that have a HBCU medical school as a partner and in good relationship with Vanderbilt. What's the problem with our committing the funds that make something like a public hospital work?
Right.
This is important. One of my church members has written a book and is trying to sue that the health industry has overcharged Americans $15 trillion. And he's had the Attorney General look at his book, and I met with him and another lawyer to look at his book and his allegations against the healthcare industry overcharging America based on his research $15 trillion.
And that comes up a lot. Let's talk about the General Hospital, because that comes up a lot. I mean, that for a lot of people, that is maybe the only solution that they can find is going to General, but they're still going to get billed. And you know, and this is a county-funded hospital. There's not a lot of those left in the state. You know, I know even out in Decatur County right now, they are struggling with trying to figure out how to fund their county hospital, and it is a lifeline out there, but it's not cheap. So, you know, speak to how vital is that kind of resource for a county like Davidson County?
First, let me just give a shout out to my friend Pastor Fuzz. It's great to hear your voice. And I think it is important to understand. I mean, we just heard from John in Cross Plains. He's ashamed to say that he has to lie to say that he's from Davidson County, but he's had 2 massive heart attacks. What does he do? There's no resource like that outside of Davidson County in this immediate area. And that just speaks to what an important resource General is. It's also the teaching facility for Meharry Medical College, which is an enormous national resource that trains the majority of its graduates go to serve underserved populations. And it is, if you go outside of Nashville and you go outside of Tennessee, people know about Meharry. They know the role that it plays, and General plays a critical role in that, not only serving for our residents, but as a teaching facility for new physicians and nurses and other healthcare professionals.
Taking this outside of numbers and facilities and statistics, what does this do to a person? What does it do to someone when they're stuck like this?
Well, it's embarrassing. You know, you're talking about working people who are proud of working and of being self-reliant and it's embarrassing when they feel like they can't provide for their own needs. And yet, with healthcare costing what it does, I mean, Chris, I've represented airline pilots, lawyers, even physicians, even doctors, architects, professionals who, in the right set of circumstances, like Betty, you know, you have an accident, you have a child with severe medical needs, it can ruin a family. And so no one is really secure without health insurance. That's the truth of the matter. And it doesn't take much of an injury or an illness to bankrupt most families.
Or some kind of life circumstance. I mean,
Right.
you lose your job,
Right.
and then the coverage goes away, and you're looking for, maybe you're just trying to pay rent, and then you're
on
not
a high
having
wire.
insurance.
You're on a high wire without a safety net.
Right. And then if you fall hard.
Right.
And sometimes, I mean, like a lot of people say, they fall into bankruptcy.
Right.
I mean, what are you supposed to do? It struck me talking to Betty there. She was telling us that she was upside down on her car loan, and that car was the only thing she has left. And so
Right.
then you become homeless. I mean,
Right.
and it doesn't take much.
Right.
I mean, it really doesn't take much.
Leading cause of bankruptcy is medical debt, uncovered medical debt. So I want to sound a positive note, which is I think the reason why there are so many people in the coverage gap is because of the animosity towards towards President Obama and Obamacare, which I think is unfortunate that our state lawmakers have let that fog their vision and use that as a reason not to take care of the constituents. I think with Obamacare no longer being a factor, I'm hoping that people will refocus where they need to be. What's the right thing to do by Tennesseans?
Yeah.
And leaving $1 billion on the table for health care for people who need it is not the right thing to do.
We have Norm, who is on line 5. And Norm, I have been told that you are an insurance broker.
Yes, I am.
Okay, and for healthcare insurance?
Yes, I specialize in healthcare insurance. I got into the business in 2007, and originally I was working with United Healthcare and Aetna and Humana. And when the Affordable Care Act was on the horizon, I had considerations about it because I knew that it was going to. I knew the political situation here in Tennessee, and I also knew that that it was going to contribute mightily to the debt. And as far as the coverage gap is concerned, you have to be almost in an income donut hole to be able to qualify for subsidies. I've seen rates, like I've got clients in Virginia, 60-year-old man, his insurance premiums have risen from $400 to $700 to $1,300 to now he got a letter saying that they have 5 less plans in Virginia, and it's going to cost him $2,300 a month.
Wow.
One of the,
I mean, I couldn't afford $2,300 a month in medical insurance.
Most of my clients, I've seen astronomical. You see, the whole idea behind Obamacare was that the young, healthy ones were going to pay for the older, sick ones.
Mm-hmm.
The younger people have not flocked to Obamacare as they thought they were going to. And so I'm seeing Blue Cross Blue Shield moving out of Texas. United Healthcare and Blue Cross Blue Shield are moving out of Nashville, Chattanooga, Memphis. It's a bad situation. Fortunately, there is some help. One of the things that we're telling our clients, and every open enrollment, we have an office down in Franklin. We've enrolled thousands of people in Affordable Care Act plans, but we're also telling people about private insurance. If you're healthy, you can get health insurance with $1,000 deductibles, $2,500 deductibles for 1/4 to 1/3 of the price that you would be spending for an Obamacare plan.
So
I got to tell you, for me as an insurance agent, the part that I loved about the Affordable Care Act is that it did insure people with pre-existing conditions.
Right, and I think that is something that we have heard come up here in the last week or two. Some of these dialogues that President-elect Trump has had kind of pulling back a little bit on some of his campaign rhetoric, you know, basically just saying throw Obamacare out completely and get rid of it. You know, we have at least seen him step back a little because, you know, I think people have realized that the Affordable Care Act did do some good. I mean,
there are 21 million people who have coverage now that didn't have it before and won't have it if it goes away. If it goes away without replacing it with something that will work.
Right.
So I think the challenge is going to be, everybody acknowledges that the Affordable Care Act has problems and it needs to be strengthened, it needs to be improved. If it's going to be repealed, then the question is, what do you replace it with so that you don't leave someone with pre-existing conditions unable to get coverage?
And I think probably two of the biggest things that it has done, and that Norm was just mentioning there. One is that it's helped people with pre-existing conditions get coverage, and also, you know, it's helped cover a lot of young people, maybe, and you know that perhaps could have played into why some of these folks maybe aren't flocking to Obamacare, because a lot of them are now being covered under their parents' insurance until age 26, which, you know, may not sound like a big deal to a lot of people, but with, you know, millennials now coming out of school and they're in, you know, they have a lot of debt from school, and then maybe they're, you know, not making as much as they thought they were going to be with their first job. Yeah. Something like that is a big help too. And so there's a lot of facets of this that I think are working clearly, but, you know, clearly we have, I mean, we have all of these people who are continuing to call in, and, you know, we're talking to that are either maybe stuck and that, you know, need some kind of help. We will continue to answer your calls here on News Channel 5 Plus here on Open Line. The number to call is 615-737-PLUS. That's 615-737-PLUS. And we will continue our conversation about living in the gap coming up.